yung Taiyin lung channel day 3. So palpating the channel, pressing the points, and feeling the body surface. Sa lung 1, kung meron po tayong napalpate na tenderness, this generally indicates an acute condition in the lung organ. Usually, meron pong cold or cough. If soft nodules are palpated in this area, the lung chi is stagnant. So parang may namuo pong nodules, often due to chronic disease or blood stasis. So kumpara dun sa tenderness na napalpate, this is an acute condition. Ang formation ng nodule is chronic naman. In cases of general chi stagnation in the body, this front alarm point may be quite tender na kahit without nodules. There may also be a relative deep nodules in lung 1 in a patient who has recovered from a rather serious lung problem in the past. This represent the physical memory of that disease. So, pwede rin, pag palpate mo, may relative deep nodule, ibig sabihin, in the past, nagkaroon po ng lung condition, serious lung problem na ito, nag-signify lang yung nodules na may lung problem in the past. Changes are often palpated naman sa may lung 5. There is a soft, slightly puffy tenderness in the area, indicative of a relatively mild systemic chi stagnation. Many patients react to the general stressors of modern life with changes at this point, and regulation of Taiyin is often a necessary first step when treating such patient. Pain with light pressure, so pagdiin, indicates acute inflammatory disease. While nodules, pag napalpate ang nodules, indicate naman a chronic issue. The harder the nodule, the more likely it is that there is actual physical changes in the lung organ or respiratory tract. So, i-compare po natin kung soft lang yung nodule or mas lalo po siyang mas matigas. So, this would tell us na there is a physical changes dun sa lung organ or sa respiratory tract. Hard nodules or pain around lung 5 are often seen in chronic asthma patient where compromise in chi dynamic of the lung organ is the root cause. So, palpate natin yung lung 5, check natin yung hard nodules kung meron sa mga asthmatic patient. This type of asthma is often characterized by relatively severe inflammation of the bronchioles. Okay? There will often be a large area or hardening or deep nodules around lung 6 naman. In the case of chronic disease in the lung organ or a memory of lung disease from the past. So, pwede rin natin check yung lung 6. For long-standing lung condition, the area may also be slightly darker than the surrounding skin. Pwede po natin check din yung coloration ng skin. On the other hand, if the area is slightly reddish, mapula po, this indicates a more acute condition, often involving heat. So reddish coloration, it is an acute condition which involves heat. Slight raised papules indicate more heat, possibly toxic heat naman. So more heat pag may raised papules. Severe tenderness may indicate lung heat and is seen sometimes in pneumonia naman. Sa lung 7 and the area proximal to this point are also important. Relatively shallow nodules generally indicate external condition affecting the throat or lungs. So lung 7 for the throat and lungs, check natin. Hardness, inflexibility, and or pain in the skin around the point are often seen in chronic tracheitis or ingrowth in the trachea. If the area is very painful with sensation that the skin has adhered to the fascia below, this can be an indicative of thyroid problems. Classically, this could be seen as a problem with circulation in the collaterals of the lung channel. And explanation sometimes used by Chinese doctors when describing goiter. Most often changes of this type are found when there is also noticeable enlargement of the actual thyroid gland in the patient. So pwede natin i-check kung may actual enlargement dun sa thyroid gland. Remember that changes observed at the collateral points are not only indicative of pathology in the paired yin or yang channel, but may instead indicate a pathodynamic associated with any of the small collaterals or by cross-circulation along the path of the palpated channel. Hardening or inflexibility of the skin in the area between lung 8 and lung 9 is often seen in lung qi deficiency. So, pag may napalpate tayo na hardening or inflexibility sa area ng lung, between lung 8 and lung 9, pwede natin ma-assess as lung qi deficiency. There may even be a sensation that the skin is attached to the bone as well, which also indicates chronic lung condition. So kung matagal na po yung sakit sa lung, pag pinalpate po natin yung lung, between lung 8 and lung 9, there could be a presence of hardening or inflexibility ng skin sa area. Yung bladder 13, while not a lung channel point, is the back associated point of the lung. So back shew point po siya ng lung. Tenderness in the area represent an acute condition, and the sense of weakness or dry skin represent a chronic or deficient condition. So check po natin kung merong sense of weakness or yung dryness sa skin. So this represents a chronic or deficient condition. Actual nodules are indicative of more chronic conditions. So kung may nodules tayong nakita sa bladder 13, more chronic na po yung condition. In summary, points that most often exhibit change are lung 9, lung 6, lung 5, and lung 1. The most common point pairs used in treating condition involving the lung are lung 9 and spleen 3, lung 5 and spleen 9. Yung lung 5 and spleen 9 combination, pareho siya na Hesse point, is used to regulate the channel. It is often used as a first-line treatment of generalized qi stagnation. By contrast, yung pair naman ng lung 9 and spleen 3, both source point naman ito and is used to strengthen when there is a deficiency of Taiyin qi dynamic. So, lung 9, spleen 3 to strengthen yung deficiency. While these are the two most common pairs, there are many other points used for treating the commonly seen case of lung disharmony. So, tandaan po natin, pair combination, lung 9, spleen 3, lung 5, spleen 9. So here, meron tayong pictures. Sa tenderness, there is problem in the thyroid or trachea area. Okay, may mga symbol, yung shallow nodules, external condition affecting the throat and lungs. And yung hard nodules, more chronic issue affecting upper respiratory tract and trachea. Yung sensation that the skin is attached to the bone, most often felt in the thyroid condition. And yung pain, more inflammation and heat in the upper lung system. So, Pag yan po naramdaman dito sa mga area ng mga points, ito po yung mga symbol. Sa like soft nodules, there is cheese stasis affecting the lung. Tenderness, acute condition affecting or about to affect the lung. Yung deep nodules, blood stasis, chronic lung condition. Pag swollen, slightly raised naman, there is generalized chi stagnation in the body. Pag pain, meaning there could be an acute inflammation. Pag hard nodules, there could be changes in the lung organ due to chronic condition. So here also sa kabilang picture, hardness, there could be a lung chi deficiency sensation. Next sensation that the skin is attached to the bone, the same yung chronic lung condition. And if there is darkness, yung changes ng skin coloration, there is chronic lung issue or weak lungs. Pag redness, there is acute heat condition. Pag presence of papules, there is toxic heat affecting the lung. Pag generalized thickening of fascia, there is chronic lung issue or weak lungs. Pag deep nodules, memory of serious lung issue in the past. So, yun po.